what and how ENT and what you can do after completing ENT. What exactly the student will encounter in the 3 years of residency of an ENT.
That is the scope of ENT और आगे आने वाले time में he will be only doing this क्योंकि उसको पता ही नहीं है what are the aspects. When you come into residency, the game becomes very different.
Hello guys, welcome back once again to PW MedEd YouTube channel, and here I'm with Dr. Sanchit here. So this podcast this video is primarily going to be about discussing ENT as a career option. Most of you guys must have wanting to take ENT, but not much of clarity what exactly the subject has to offer or what we have in future when you are an ENT surgeon. So it's just a talk from the heart. So on what and how ENT and what you can do after completing ENT. So over to the questions directly. So first question, Dr. Sanchit, like most of the students, as an MBBS student, I don't get to know much about ENT as a branch. I do know about atrophic rhinitis, CSOM, maybe tinnitus. If it's better, maybe the syndromes around the petrix apex, right? So what exactly the student will encounter in the 3 years of residency of an ENT?
So thank you, Dr. Ranjith, for having me here. This is something that is really concerning और हमें ये लगता है कि बच्चे जब आते हैं थर्ड ईयर पोस्टिंग में, so हमारे पास एक लिमिटेड टाइम है. We don't have time as much as it is given to surgery, medicine, obgyny. But हमें लगता है कि उतने से टाइम में we cannot do justice to the subject और हम उतना नहीं उनको बता पाते as we can tell. So हमें क्या रहता है? We give them long cases of, let's say you read CSOM, DNS, tonsil and you're sorted. Done. इसी में ही your whole learning will be there और उसी में ही we'll rotate around. So एक perception बच्चे का क्या रहता है कि जब वो MS MD के एग्जाम में बैठता है, he thinks कि यही चीजें हैं ENT में. That is the scope of ENT और आगे आने वाले टाइम में he will be only doing this. क्योंकि उसको पता ही नहीं है what are the aspects. अच्छा, सर्जरी उसको समझ में नहीं आती because it's too intricate, microscopic, endoscopic. We can't show gross structures to them. So unless and until you become a postgraduate, you can't understand the beauty of this subject. Now, first let me tell about my own subject as to how it is. ENT has got 4 major branches where we deal with. A separate branch called as otology. Then there is rhinology, which is the nose. फिर आती है laryngology, which is the larynx and throat. Then comes head and neck surgery from the base of skull up till the clavicle. So in सारी domain में from here till here we operate. Now ENT अब हो क्या गया है कि that whenever a person is going for professional exams and whenever they come out of professional exams, उस टाइम पे थर्ड ईयर में कोई इंटरेस्टेड नहीं होता that they will become an ENT surgeon. I've not seen people getting interested कि थर्ड ईयर में उन्होंने डिसाइड कर लिया that ENT will be the branch. But that decision comes to them later और उसमें maximum लोग क्या करते हैं that they are not getting an MS seat in any other branch, so let's take ENT. And that is something I really feel bad about. Why? Because this subject has so much to offer to you. Now, when you come into residency, the game becomes very different from first year onwards. Because from first year onwards, in residency, you will be taught about the aspects inside. कि आप ear surgery में आप खोलते हो तो there are 30-40 types of ear surgeries only. When you go into rhinology, there are 20-30 types of only rhinology surgeries. Larynx is a huge domain, which we call as phonosurgery, where we change voices of people. Head and neck oncology is a different domain. Skull-based surgery is a different domain. So ये हमें समझ में आता है when we enter residency. But I think that if people get exposed to these modalities, and I think the trend is changing now, because people have started doing. अब वो कर रहे हैं, they are showing people that what all things are there, they are taking out the pituitary from the nose. So now the child will get interested कि यार ये करते हैं ENT surgeons. So by that time, when they reach into these exams and they have a choice to get that subject, they become very clear that they can take up this subject because it has got a great prospect ahead.
Perfect. So this kind of answers my second leading question as well. The second question is like saturation. So it's a very common topic which comes on like ENT is being saturated. Is really ENT saturated, or there's one more passing comment has been mentioned. Most of the disease on ear, nose, throat, a general physician can take care of it. So why do I need a specialist? So what are job prospects for a resident who completes it, and is it really saturated? What's your opinion on that?
Okay, so that is something many people ask when they enter into this domain. I'll answer the first question, that is it saturated or not? I feel every subject's saturation lies in the person, not the subject.
True.
So if we have got a scope to go forward, we can do anything in any subject.
Definitely.
It's upon us that we want to do only 4 things, so we are saturated, of course. So ENT surgery, if you ask me personally, till the end of life, I cannot finish ENT surgery. It has got that much to do. क्योंकि इतनी domain है, there are approximately 10 super specialities which open up MS करने के बाद.
Okay.
So there is an option where you can go only into ear surgeries. So करने के लिए बहुत कुछ है. So I feel saturation is something that you shouldn't worry about. And as far as it's upon the people that how much you want to do. बहुत लोग कहते हैं कि ठीक है, we are happy कि हम 4 सर्जरी करते हैं, इसी में we can earn. But I have seen ENT surgeons जो hundreds टाइप की सर्जरी करते हैं from base of skull up till clavicle, and उनका saturation तो हो ही नहीं सकता because there is such a big learning curve. So saturation, of course, not there. It's upon you that how much you learn and how much you can go forward with. Coming to the second question, yes, of course, most of the ENT symptoms are treated by general physicians. But now the complete trend has changed. Now this was before. The people used to go to GPs, but now you see the patient's mentality is
very well aware.
Exactly. So if the patient even has got stomach pain, तो वो general surgeon के पास नहीं जाएगा, वो एक gastro को दिखाएगा. Similarly, if the patient has got a kidney where they won't go to a general physician, they'll go to a kidney specialist.
True.
The same goes for ear, nose, throat disorders. General physician can guide that person by giving something. But ear, nose, and throat, and if you see, all our domain is about special senses. So patients usually don't take that chance on special senses. क्योंकि जब वो चली जाती है, people realize that. Same we saw in COVID.
Yeah.
जब लोगों का taste चला गया, people really respected that taste. Smell चली गई, people really concerned about कि smell कैसे वापस आएगी. So it's a good balance between a surgical as well as a medical specialty. You've got a good OPD, even if you don't want to do surgeries, and you've got tons of surgery to do.
Great. So amazing. Sanchit, you kept mentioning that there are multiple things to do in ENT. So if a student has now completed MS ENT, what are the opportunities, or first question, does he need fellowship or an MCH? If yes, so what are the options or what are the domains they can specialize?
Okay. So as far as ENT is concerned, nowadays ENT is not an end branch.
Okay.
And I think वो सारे subjects के साथ है, there are no more end branches. Because we have gone into super specialty so much and people have started doing one thing they can be confident about. So ENT में the same thing goes. There are two options post ENT. One is you pursue fellowships. They are short-term fellowships to long-term fellowships that range from institutional fellowships for 3 months to 2 to 3 years.
Okay.
Then comes other side is MCH that you have to choose one branch post ENT और उसमें आप 3 साल specialize करते हो.
Okay.
Now MCH में there are currently 4 options in which post ENT that have been added by NMC you can do MCHN. One is neurosurgery. Second is surgical oncology, third is head and neck surgery, and the fourth is plastic surgery.
Okay.
So during ENT, if someone gets too much interested into any of these branches,
they can.
वो 3 साल के लिए they can go and practice. Now the thing lies कि अगर आप MCH करते हो, you have to be very sure because after that MCH आप regular ENT में नहीं रहते.
Yeah.
So if you are interested in doing
specialist.
Exactly, तो आप head and neck ही करोगे. You won't do ear and nose.
True.
If you want to stay in touch with everything, कि आप ear भी करना चाहते हो, nose भी करना, you want to do all sorts of ENT work, people then choose to do fellowships in the area which they're really interested into.
Got it.
So in that, we have got otology fellowships, जिसमें super specialization lies in something called as neuro-otology. Lateral skull-based surgery, where we enter inside the skull, base of skull through the mastoid bone. There is something called as implant otology, which is dealing with cochlear implant and middle ear implants. There is something called as endoscopic ear surgery, जिसमें they are doing scarless endoscopic approaches. So these are the options in otology. If people are too much interested in rhinology, तो वो हमें पता चल जाता है during MS we are good with the endoscope. So then they can specialize in rhinoplasties, that is the external framework surgeries. They can go into endoscopic skull-based approaches. So anterior skull-based surgery, मतलब कि we usually base of skull such as the pituitary, frontal lobe. So all of these surgeries can be done with ENT surgeons. They usually come in conjunction with neurosurgery. Then after that, if you're really interested in the other branches such as head and neck, there are fellowships in head and neck oncosurgery, which you can do. They again range from 1 to 2 years. Then if you're interested in larynx, there are fellowships in phonosurgery, जिसमें you do all types of voice procedures, like changing a male's voice to a female's voice to a male voice, pathologies of the vocal cord. Then there is a specific field for pediatrics that is called as pediatric otolaryngology, जिसमें we do all the pediatric cases. There's a separate field for allergy and asthma,
Okay.
where people specialize for 2 years only on allergic disorders because there is a huge chunk of allergic patients.
True.
Then there is a specific field in fellowship that is for obstructive sleep apnea and surgeries, where they usually work with sleep medicine doctors. So there are a lot of options, plethora of options post MS ENT, and that is why I don't say it is an end branch anymore.
True, like I think this must have been an information to quite a few of learners here. Like it's vast, it's not limited at all. So last but the one question, which is one of the burning questions for anyone who's going to enter the thing, what are their prospects? How much they can earn?
Okay, so earning again depends upon the guy who's doing it. And when you start, like post MS, when you join a medical college and आपको एक senior residency करनी होती है. So as far as a senior resident is concerned, again state-wise you have got different packages. If you come to the northern part of India, so in that you can get up to 1.5 to 2 lakhs as a starting in any medical college. If you have got a fellowship, then you can grab up to 2 to 2.2. If you go to South India, there the packages are a little low. अगर आप residency करते हो, even in Maharashtra, the senior resident usually get around about 1 to 1.2 lakhs or 1.25 lakhs package when you start as a senior resident. But again, I say the earning perspective shouldn't be there in senior residency. It should be a learning perspective. So you shouldn't choose your college senior residency में earning को लेके. आप learning को देख के रखो that you will get maximum hands-on. Anytime a surgeon can come out and open their own shop outside.
Perfect.
So when you have your own clinic, after 3-4 years doing fellowships, आपके पास एक experience आ गया है. When you do your job outside, it's an unlimited scope on you because you have got your OPD where you can earn from, that is unlimited. It's got no limit. And even if you do one surgery per week, so that one surgery of ENT, even a basic ENT surgery can fetch you around 30 to 35,000 rupees. That is on the lower scale. But if you go to corporates, it's much higher. But एक surgery is around 30 to 35,000. If you go to specialty surgeries like onco, that is around in lakhs of rupees. So it again depends upon how much you can practice, how much you want to practice, and when you open your own clinic, it's an endless opportunity.
Got it. Great. So most of the students ask about the earning potential, like you said, my thing is very simple. Time is what is going to give you more. So
Correct.
more time you spend and more time you're ready to spend is
Right.
what is going to directly link you to the earning potential. And the branches are just a push start. It's a
Correct.
push start, and whatever you want to go, like Sanchit said, like sky's the limit if you want to pursue, and the opportunity is also available
If
multiple.
you're really wanting to be a BMW doctor, you can be a BMW doctor.
True.
Otherwise, you can be happy with an Alto.
Perfect.
So
It's left to them.
It's left to them.
And the choice is never right or wrong. It's
Exactly. So
personalized.
the more you learn, the more you earn.
That's
It's proportional.
Perfect. So thank you, Dr. Sanchit. This is a nice conversation, and I think many questions would have been an eye-opening thing for any student who's trying to aspire to become an ENT surgeon. And guys, if you have any comments to ask Dr. Sanchit, put in the comment box. Let's come live again and discuss more things together. See you soon. Bye-bye.